Pretty soon we're going to see springtime arise, so to speak. One would hope, anyway. And with that is going to be a lot more traffic out on the highways and byways as far as people getting out and running and doing whatever. A lot of people are doing it already, but one of the things that can happen is that, anybody who runs can suffer an injury. And we are joined now by Dr. James Vanhuysen, who is a sports medicine physician at Bronson Healthcare Midwest. Good morning, Dr. Vanhuysen. How are you?
Good morning, Jim. Thanks for having me on
this morning. It's nice to have you on. All right, so we're going to talk about stress fractures. What exactly is a stress fracture?
Stress fracture is an overuse injury from, a lot of times it's caused from basically going too much too soon in terms of running or sports. And the analogy I use a lot of times with patients is it's kind of like bending a paper clip. You bend it once or twice, it's probably not a big deal. If you keep bending it too much too soon, you can develop some fatigue in the bone and a stress fracture can develop.
Now, are there some bones that we have that are more susceptible possibly than others?
Certainly, yeah. In runners, in athletes, the vast majority of stress fractures tend to be in the foot, the long bones in the foot. They're called your metatarsals, tend to be one that's routinely involved. The other ones that can be involved is your shin or your tibia, and those can be a big deal for people.
Talking with Dr. James Vanhuysen of the sports medicine area over at Bronson Healthcare Midwest. All right, so Dr. Vanhuysen, what activities do athletes and actually people, everyday people, what kind of activities make them more susceptible to a stress fracture?
Runners are certainly at risk. Any sport where you're cutting, pivoting, so like tennis, soccer, basketball, tend to have a higher incidence. But the biggest thing is in terms of predicting who's going to get them is, have you had one before? So if you had a stress fracture in the past, you're certainly at higher risk to get one. And then the other big thing is how your training program and how quickly you advance things. If you do too much too soon in terms of duration, intensity, or if you change the surface you're training on, sometimes that can predispose you to end up with a stress fracture.
Speaking of predisposition, are women more susceptible than men to stress fractures?
They can be, and there's a couple. There's a condition that's unique to females. It's called female athlete triad, and that is usually in higher level female athletes that they can end up with irregular periods, and that can affect their bone density. So the female athlete triad includes stress fractures, irregular periods, and the other thing that's a component is disordered eating, so like anorexia or bulimia. And that's a big deal because that can have not just in the short term, but it can have long-term major implications for your bone density as you go on through life. So that's something in any female that comes in that we're worried about a stress fracture. Those are questions that we ask for sure.
Dr. James Vanhuysen, a sports medicine physician at Bronson Healthcare Midwest, joining us for our Bronson Med Chat on this Thursday morning. All right, so Dr. Vanhuysen, how can people recognize them? What are the symptoms of a stress fracture?
Well, if pain is the big one, and usually it comes on. So in the instance of a runner, usually it comes on during the course of the run and tends to get worse with time, and then as it progresses, it'll come on sooner and sooner in the run. So certainly if you're having any of those symptoms, it warrants coming in and having one of us take a look and make sure that you have not developed a stress fracture.
So once they come in and see you then, Dr. Vanhuysen, get it diagnosed, how do you treat a stress fracture?
The big thing is, so if it's in the lower extremity, so the foot or the shin, a lot of times we'll immobilize you for a little while, so like in a boot, and basically stop bending the paperclip. And Then moving forward, we slowly work you back into activity. We make sure that there's not any other reasons from a metabolic perspective. So like if you have thyroid issues, your vitamin D levels low, things like that could predispose you to having a stress fracture. We check for all that stuff.
So to use your analogy, Dr. Vanhuysen, how do we keep from bending that paper clip? How do we prevent stress fractures?
Yep. Slow and steady. So the textbook answer in terms of progressing the training for runners in particular would be no more than 10% increase in your volume per week. The other way is to work under the guidance of someone who knows what they're doing in terms of training. So like the trainers out at the Bronson Athletic Club, Gazelle Sports has a running group where they do group training. I think those are two great community resources.
Dr. James Vanhuysen is a sports medicine physician at the Bronson Healthcare Midwest and give us some good advice and information on stress fractures. 'Tis the season soon for go out running, so I would imagine, Dr. Vanhuysen, that people need to be aware of what can cause it, how to prevent it, and when it does happen, how to treat it relatively quickly.
Absolutely. Hopefully the snow melts soon so people can get out and start being active.
That'll be nice. Dr. Vanhuysen, thank you so much for joining us. We appreciate it.
Yeah, thanks for having me.
Take care. All right. Have a wonderful day. Dr. James Vanhuysen, sports medicine physician at Bronson Healthcare Midwest.